Oxygen therapy, we use this cannula, and what will happen is we'll put them on what's called an oxygen concentrator, and what we'll do is we get them on the oxygen, which is fuel, and we'll provide them with some type of activation. So we may do some left cerebellar exercises, some balance exercises. We may have you do some nonlinear complex movements with that side of your body. We may put you on a UBE, which is like a cycle that you use for your arms. That will stimulate and fire up the brain. So everything that we do here functionally with these patients with balance disorders, we get them on oxygen. The cerebellum, which controls your balance, is the most oxygen-dependent part of your body. So typically, over the years, people will undergo what's called oxidative phosphorylation, which means that they won't be able to utilize their oxygen as well, and that can cause some of these decreased areas of function in certain parts of your brain. So oxygen is absolutely critical. We want to provide the brain with fuel and activation. The other thing that we may do is we may do specific types of eye exercises. Let's say we find out that the right side of your brain isn't functioning well, we'll have you do eye exercises where you're moving your eyes to the left. We may do some olfactory stim. We may have you smell different smells to fire up weak areas in your brain. We may do something called a caloric. A warm caloric, will actually put warm water in this external ear here, which will heat up the endolymph inside the vestibular system, and that sends a message to that side of the cerebellum. So if you've got a weak left cerebellum, we may do a warm caloric on the left side to stimulate that side. We may do vibration on the left side of your body to stimulate the muscle and joint feedback system. Another great way to stimulate the muscle and joint feedback system is with gentle chiropractic adjustments on the side of your body that's not functioning. So if you've got a bad left cerebellum causing your balance disorder, we want to stimulate the left side of your cerebellum. We can do that using, I know some patients would like to have as gentle of care as possible, so we may use an instrument. This is a very light instrument that's just going to put a little light force stimulation on the left side of the spine, and that will stimulate the left side of the brain, left side of the cerebellum. So that's an important thing that we do. Now, a lot of patients that have dizziness also have neck problems. They may have lower back degeneration, bulging and herniated discs. And so to improve the muscle and joint feedback system, we may use something called non-surgical spinal decompression therapy, which is a slow stretch to the discs in your spine. What it does is it takes a slow stretch and it activates these muscle and joint feedback system, which goes up and feeds the brain and really improves the function of the brain. We'll put patients on oxygen while we do spinal decompression therapy. Another type of therapy that we use with patients with balance disorders is the interactive metronome. Now, the interactive metronome is a computer-based program where you're going to wear these headphones, and what you're going to hear is you're going to hear an auditory reference tune or an auditory reference bean. Cowbell. It's going to sound like a little bing, bing. It's going to sound like that. And what's going to happen is you're going to have to clap or do a gross motor activity with either your feet or with your hands or with your arms to the beat. And what that develops is it develops timing and it develops coordination between all of these systems here. And that can really enhance somebody and help somebody with balance disorder. So patients, especially people that are having a hard time on their feet, we're going to get them doing things that are going to develop the part of their brain that's going to make them more steady. So that's just a couple of the different treatments. There's probably 100 other treatments that we may do specific to your examination. Now, that's the stimulations. Remember, brain needs fuel and activation. Fuel comes in the form of oxygen. We've talked about that. Absolutely critical for patients with balance disorders and vertigo. The other thing is looking at blood panels and determining how you are doing metabolically. So we send out patients for blood sugar tests. We'll look at their blood sugar panels. We'll look at thyroid function. We'll look at adrenal function. We'll do a complete blood count. We sometimes will send patients out for food sensitivity testing and autoimmune testing. We do special tests for autoimmune function, especially for people with Meniere's disease and this recurrent otoconia debris that occurs in the inner ear, because a lot of times that is due to an autoimmune condition that's attacking the area of your brain that causes you to be stable. So some people are highly allergic to things that they're eating. Gluten sensitivities. They may have an autoimmune reaction to different types of foods, egg, milk, things like that. So we want to really rule out all those issues that may be affecting you metabolically. We look at your blood panels through a preventative medicine integrated medicine approach, which means that when we look at your blood panels, we really want to make sure that things are as tight as possible. You may not have diabetes, but you may have what's called insulin resistance. So your blood sugars may be not where they need to be, but they're not defined as diabetes. And that could be causing a problem. This high blood sugars may be causing some neuropathies in your feet. You may have adrenals that aren't functioning well. So we want to get you metabolically as healthy as possible, because that's going to develop good fuel for the nerves, so those nerves can develop healthy neuroplasticity, which is going to create balance in these systems, which is going to get you better. And that's why we help people get better who have been to 7, 8 different doctors, have tried everything, because medicine only treats the pathology, which is the hard lesions, and they only treat the inner ear, BPPV. And they typically, when they do that, they don't do any rehabilitation functionally of the nervous system. So if you're suffering with these types of problems, the balance disorders, the vertigos, and you've been to multiple doctors and nobody has an answer for you, everybody's telling you, you know, you're going to have to learn to live with it, take this medication, and you're serious about finding out about a drug-free solution, call our office at 610-518-3370, and we will do a complimentary balance disorder vertigo consultation to determine if you're somebody we can help in the practice. Thanks a lot for listening, and take care.